Good evening, good evening, good evening. Thank you for tuning in. My name is Lee Smith, and I'm the current Vice Polemarch of the Brooklyn, Long Island Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. As part of our community service efforts, the Brooklyn, Long Island Alumni Chapter regularly hosts community events to educate our constituents on issues that affect us all. COVID-19 has, of course, relegated a lot of us to virtual spaces. But the need to continue our education efforts around these issues is now more important than ever. For Black History Month, we wanted to include weekly virtual programming that allows us the opportunity to hear from experts from various professions from the comfort and safety of your homes. Tonight, we're back and in partnership with New York Presbyterian Hospital and our guest, Dr. Alfred Winkler, who will walk us through tonight's topic, navigating COVID-19, the variants, and the vaccine. Dr. Alfred C. Winkler, MD, received his Bachelor of Arts degree from Princeton University in 1989. He went on to pursue medicine at SUNY Stony Brook School of Medicine, where he was awarded his medical doctorate in 1993. He completed his residency at Albert Einstein College of Medicine in 1999. He has been a board-certified urologist and member of the American Urologic Association since 1999. In 2015, he was awarded a master's in business from NYU. Prior to joining New York Presbyterian and Weill Cornell Medicine, Dr. Winkler held urology residency site director positions at both the Albert Einstein College of Medicine and the Icahn School of Medicine. He was also chief of urology at Jacobi Medical Center, North Central Bronx Hospital, and subsequently Elmhurst Hospital Center, Queens Hospital Center. He won resident teaching awards at both residency programs. He is currently the chief of urology at New York Presbyterian, Brooklyn Methodist Hospital, and the New York Presbyterian Lower Manhattan Hospital. Dr. Winkler believes the patient education is essential to the collaborative effort between physician and patient to achieve an optimal outcome. In his practice, he spends the extra time to make certain his patients have a thorough understanding of both their illness and the treatment options available. Dr. Winkler's particular area of focus are men's health, stone disease, as well as voiding dysfunction in both men and women. A particular passion is community health awareness of urologic disease. Dr. Winkler has organized numerous educational and screening programs involving prostate cancer awareness and bladder health. So Dr. Winkler, thank you so much for joining us this evening.
So thank you for the opportunity. Thank you for that introduction. You know, as time goes on, I hear those years that I graduated and it's sounding longer and longer ago. So, but it's a pleasure to be here.
Yes. So, as I laid out in your bio, you are a urologist, but tonight we're here to talk about COVID-19, and clearly COVID-19 affects, as we're hearing in the news, it affects the entire body. So what I'll do is I'll just turn over the handles to you and let you do your presentation, and then we'll come back in for some Q&A.
All right, sounds good. All right, so let's pull up the first slide. Okay, so a lot of you have heard a lot of information about COVID, and today we're going to stick to the facts of COVID. Hopefully there's some new things you'll pick up, but one of the things that everybody struggle with is that there's so much information. So one of my jobs is to give you facts that are proven and reliable information. So here we go. Next slide. So this, for a long time now, has been the central question. At the beginning of the pandemic, there was no vaccine. And that was a particularly scary time. And the only tools we really had to protect ourselves were masks, as we learned very quickly, and distancing. And the advent of vaccines really was something that really changed things in terms of the fight of this disease. But in some ways, surprisingly, it brought about a tremendous amount of hesitancy, a tremendous amount of trepidation and a lot of information and misinformation that affected your decision to get vaccinated. So the central question very quickly became, why should I get vaccinated? Next slide. So number one, to protect yourself. So when you're on a plane and you're going through those safety checks at the beginning, and they talk about those masks that drop, the first thing they said is put a mask on yourself, okay? Because you have to protect yourself first before you can start to protect other people. So you protect yourself first with vaccines. You protect the people most immediately around you, your family, your loved ones, and your community. And then really there's a greater responsibility in terms of you getting vaccinated, helping to end the pandemic. Next slide. So here's a question. How many people have died of COVID-19 in the United States? 100,000, about 300,000, about 900,000, or over 1 million. So, there are many Zoom meetings that you will participate where there are quizzes and there are all sorts of graphs and graphs about how many people got something right. This is a blameless quiz. So this is only to learn. So next slide. So over 900,000 have died of COVID-19 in the United States. Next slide. So again, the question for a long time that people have faced is, why should I get vaccinated? And as I said, it begins with, you really need to start with protecting yourself. And if you look at this slide, there are lots of different symptoms that people with COVID-19 have. And some of them are symptoms of the common cold, a runny nose, fever, chills, or a cough. Some of them are associated with other issues like diarrhea, muscle or body aches, headaches. A major one that's fairly unique to COVID has been loss of taste or smell and a sore throat. But this just is one of the first signals that this particular virus affects many parts of the body, many systems of the body. Currently, over 100,000 people are hospitalized with COVID. And we've talked a little bit about the deaths, but it just shows you that COVID can have many manifestations and sometimes no obvious manifestations. Next slide. When COVID first began, we thought of it really as a respiratory disease, a disease that affects your breathing. But as we quickly learned, with that first big group of patients who are hospitalized and terribly sick, it affects many, many different organ systems in the body: heart, kidney function, your lungs. Many people complain of brain fog or nerve problems, the increased risk of blood clots, which in and of themselves can be dangerous to your health and sometimes deadly. And what we're seeing more and more is that a significant percentage, over 1/3 of patients who are COVID survivors have long-term effects. And these effects can affect any of those symptoms. And already we can tell that 5 or 10 years down the road, one of the things that we're going to ask when we're doing a history of patients is whether or not you had COVID, because it's turned out to be to manifest so many different issues, even after the primary disease has resolved. Next slide. So we talk about getting vaccinated to protect yourself. And that's important because not only are we talking about the manifestation that COVID can have on you, it's also what it means for you to spread it to other people. And that's in particular people who are not vaccinated. So that's really the next level of why to get vaccinated. Next slide. All right, so this should be a pretty easy one. Again, blameless quiz, no scoring here. How many vaccines are authorized in the United States? A is 5, B is 2, C is 1, and D is 3. I think most folks know the answer to this one. Next slide. 3. Okay, so Pfizer, Moderna, and J&J Johnson & Johnson are the 3 vaccines that are authorized. Next slide. Next important question. So if I'm thinking about getting a vaccine, I want to know if these vaccines work. Do these vaccines make a difference? Next slide. So one thing that has been borne out and continues to be borne out is that the vaccines are very highly effective. And what's been very clear, in particular in this wave of COVID, is those folks who have been vaccinated truly are protected. And really the whole time, the goal of vaccination is to prevent people from getting very sick. Because we saw the devastating effects of COVID very early on. And the challenging thing when it came to COVID is you could catch COVID, you can catch the virus, and you just really wouldn't know how things would turn out for you. You could have almost no symptoms. You could lose your sense of taste. You could have breathing problems. You could have breathing problems and end up in the hospital. You could have breathing problems and end up in the hospital on a ventilator. Or you could have breathing problems, end up on a ventilator in the hospital and not survive it. And it was difficult to tell who was going to fall into which category. So the primary goal of the vaccines was to, number one, keep people from getting sick and getting hospitalized and being able to tolerate the infection. And that has been proven through and through. Next slide. This is the number one thing that I think really prevented people from getting vaccinated, and what really gave people caution is concern about vaccine safety. Next slide. So the vaccines were studied in tens of thousands of people. I know that can be difficult to believe because everything evolved in such a short time. But for reasons we're going to go into in a few minutes, they were able to study many more people in a shorter period of time to determine the safety of the vaccine. And at this point, I think it's more than 400. I think it's more than 550 million people have been vaccinated in the United States, and the vast majority of those folks have done very well and tolerate the vaccine well. Next slide. So the question within the question is, how did they make the vaccine so quickly? Next slide. So one of the misconceptions about the COVID vaccine is that the science is brand new. And that is not true. So the science and the technology that was able to bring about the vaccine is based on decades of research on very similar vaccines. The other difference really comes down to competition. So typically, when a particular vaccine is developed, it's developed by one company. They're frankly trying to make a unique product. They get a patent on it. There are very few people comparatively who are part of studies. I think perhaps this is one of the greatest examples of collaboration that we've ever seen in the pharmaceutical industry, where everyone leveraged their resources in a spirit that was not competition, to share information, increase the number of patients who participated in the studies, and even probably the most important to me was increase the diversity of people who were included in the trials in a way that has really not been seen before. One of the struggles that I have as a physician who takes care of a lot of people of color is a lot of the studies that are used that look at different treatments, different surgeries. The group that's examined to determine how effective these studies, these surgeries or medications are very homogeneous groups that do not include or include a very, very small percentage of people of color. That was fortunately not the case. And I can tell you that that helped my trust in terms of my decision to get vaccinated. And all the same safety standards and expert reviews as are customarily used were used with the development of these 3 vaccines. Next slide. So the traditional vaccine timeline, and again, this is one corporation, a single lab, sort of starting the research. And because there is really a smaller group of people contributing to the research, everything takes much longer. There are not as many patients to study. The diversity of those patients aren't what you would want. The information is closely guarded, and that really draws the time out for a drug to even make it to that 5 to 7 year point where it is eligible for FDA and CDC expert review. So that's how things are typically developed. Next slide. So what's different here is a couple of key things. So the body of research that was used in a collaborative way was much, much larger than what we see before. And the other thing is they did not wait for the testing to be complete before they produced it. So this was a risk to these companies that they were going to produce something that wasn't a sure thing, but it was such an urgent public health crisis, literally a crisis, that they produced while they were testing, so that as soon it was clear that there was adequate testing and an adequate degree of safety evaluation, that they were able to send it over to the FDA and CDC for expert review. So it's really the consolidation of expertise and the consolidation of production that really made this come to fruition in a safe way in a shorter period of time. Next slide. Because it was such an urgent public matter, an urgent public crisis, this really became the priority for the FDA and the CDC. And there was a lot of focus on all of these vaccines, really to the exclusion of almost everything else that they had to review. And that it's that prioritization that also helped expedite development of the vaccines. Next slide. So in the last year, everybody's probably heard the word variant more than they ever had in the years combined. And this is what is important to understand about variants. So a vaccine essentially is a way of your body to produce protection, a sort of armor of sort, so that a virus cannot cause a significant infection. But viruses are very smart, and they have a way of evading the immune system. So you can almost think of this particular set of vaccines being able to show your immune system a most wanted poster of COVID. So when that virus is exposed to your immune system, the vaccines arm it with the ability to identify and destroy the virus. But what viruses do over time is they disguise their appearance. There are little subtle variances in how the virus is constructed that makes it easier for it to evade the immune system. And those little changes, those little disguises are essentially what variants are. Fortunately, the vaccines that have been produced have been still very effective against the variants. But the issue is every time the virus infects someone who isn't vaccinated, it gives it the opportunity to become a little smarter, a little bit better at disguising itself, and a little bit tougher to combat. Next slide. So we went through this transition where it really wasn't so much about getting vaccinated in the first place. It was sort of the decision, and a lot of people are going through this decision right now, which is, should I get a booster shot? I know people still have those same safety concerns, the concerns about whether or not they have to do that. Many people are really faced with this decision in a way that it really affects their livelihoods in terms of their ability to continue to work at their current place of work because of requirements. So what also has been borne out over time is that booster shots have been safe and very effective. And the side effects from a vaccine or a vaccine booster from COVID-19 have been very mild. Next slide. So now, as we have gone from vaccine to booster, the next sort of phase of questions that we're dealing with is younger folks in the community, and can they be vaccinated? So this may be our last question or close to our last question. Can a 9-year-old be vaccinated? So 50-50, yes or no? Next slide. Yes, a 9-year-old girl can be vaccinated. Next slide. So there was particular attention paid to safety in younger folks, and that's ages 5 to 11. So when the adults were thinking about whether or not they should get vaccinated in the first place months and months ago, there were already studies ongoing in children age 5 to 11 to make sure it was not only safe, but it was effective. And we really did this in 3 batches: adults, then adolescents, and then children ages 5 to 11. So the vaccine has been extremely effective in ages 5 to 11. It's been proven to be over 90% effective, and it produces as good an antibody response. It produces that armor, or that same most wanted poster in younger kids as it did, or as it does in older adults. Next slide. Are there side effects for children? So what was nice to hear is that the side effects for children aged 5 to 11 were very similar, and there were actually fewer reports of the most common side effects, which are pain, fever, headaches, tiredness, and muscle aches. So children tolerated, and the youngest of children who were vaccinating tolerated these side effects very, very well. Next slide. Okay, so there is different types of COVID testing. One of the challenges when the virus first came out, and the testing that we had was people were getting antibody tests, and those were a challenge because we really didn't know how to use them or what they meant. And basically, the antibody tests showed that you were exposed to the virus and your body was able to mount some sort of immune response. But the thing that we didn't understand was how durable or how protective that immune response was. But we've come a fair distance from that, and we have much more certainty in our testing. So there's sort of 2 sort of groups or batches of testing. One is molecular testing and one is antigen testing. The molecular testing is also known as the PCR. That's the one that you'll hear most common. And the antigen testing that you'll hear about the most is rapid testing. So with molecular testing, you have that very, very pleasant test where they swab the back of your nose or your nasopharynx. Same thing with antigen testing. With the molecular testing, what you're looking for is the presence of the virus's genetic material. With the antigen testing, it's a little bit different. It's just the presence of one or more proteins that are part of the virus. So the molecular test is a little bit better, a little bit more reliable than the antigen testing. So why would you get this test? So the molecular test or the PCR test, which we use in the hospital, is to accurately diagnose or rule out an active coronavirus infection. So for instance, before I operate on someone, we do a coronavirus test and we use a PCR because we absolutely need the best test possible to know whether or not someone has a coronavirus infection. The antigen test is faster and the results are back in as soon as 15 minutes, but it's not quite as reliable. So it's a difference of 90 to 95%, even a little bit more than 95%. And with the antigen test, it's more like 85%. So as I sort of implied before, the molecular or the PCR test is really the gold standard test. And when we get those results, we know we're secure that the patient does not have COVID, and we move forward as if they don't. The antigen test isn't quite as reliable. The positive tests are generally more accurate, but if you really want to know, you would do the PCR or the molecular test. Okay. Next slide. So who can get the vaccine? Next slide. So all New Yorkers ages 5 and up are eligible for the COVID-19 vaccine. This is regardless of your immigration status. The COVID vaccinations are free. You do not need government ID or social security number to get the vaccine. And this is important because some of the hardest hit communities in our city don't have a social security number, don't have government ID, are not able to prove or show their immigration status. So this really truly is available to everyone for free. Next slide. Next slide. So I'm sure that folks have seen or a lot of places, a lot of resources to get a vaccine. These are just some general resources that's available of everyone about and that gives information about how to make a vaccine appointment. The New York State vaccination hotline, the New York City COVID-19 vaccination hotline, and New York Presbyterian also has a number. And I am sure there's a way that we can share this moving forward. Next slide. So as we have seen, it'll take time for everyone to be vaccinated, but you have to keep doing what works. And if you remember the summer after we first had the first wave of COVID, the thing that really turned the city around, the thing that made the biggest difference by far was people wearing a mask. Washing your hand was important. Obviously, keeping your distance was important, but the mask really made a difference. And this is reminiscent to me of when there was the SARS epidemic in Asia. Not that this was the only thing, but it really sort of made a culture shift in terms of how often and when people wear masks. And I think that is going to become a reality here. But again, people really did a fantastic job in the city in terms of wearing masks and making a difference. Next slide. So, as I said at the beginning, people have been exposed to a ton of this information. I gave you more. Hopefully after this, you'll keep asking questions, especially if you still have yet to make a decision about getting vaccinated. Next slide. So this is a great one for towards the end, because this is incredibly important. And this was sort of the basis of a lot of misinformation at the beginning of the pandemic. So another 50-50 question. Will the vaccine give me COVID? Yes or no? And the answer is no. Next slide. So there are lots of different questions. One of the big ones that I get as a urologist is, can the vaccine cause infertility? Another one I get often is, does the vaccine affect my sexual function? There are always tons of questions. I think, like everything in life, just consider the source of where you get your information. Next slide. Okay, so for more information, so so the second source, the CDC, is where I get all of my information. If I want to find out sort of what the most up-to-date guidance is, I go to the CDC. They have a public responsibility to give the most accurate and updated information possible. You know, I have my news sources for many different things, but for this, I will always go to the CDC first. Next slide. Thank you for your time. I know that a lot of people have COVID fatigue, and the fact that you made an effort to listen to this talk, I appreciate and I applaud you for doing.
Thank you, Dr. Winkler, for that informative presentation on COVID. And I was listening intently to some of the questions that you had towards the end of the presentation. And we have some pre-curated questions. I'm sure some of the folks that are viewing will probably have some as well. But I think a lot of the information too will be even more well received just through conversation. So we're just going to have a little Q&A with each other here. So when we talk about COVID, where are we in the global fight against the novel virus? You know, it's a new virus, and I know that, you know, it's clearly not an American thing. It started, you know, in China and moved its way. Initially, when it first started, it was heavily hitting Italy. Italy shut down quite a bit. So where are we in terms of being able to globally be able to start to beat the virus back? So
that story is still being told. So as you can see locally, and in our region, there's talks about and in fact some measures to roll back some of the mask requirements. Mm-hmm. That's happening in Europe also. Mm-hmm. You know, like everything in the last, I would say, 4 to 6 years, we have to hope, and in general, these decisions are being based on science. Mm-hmm. The thing that gives me pause is our sort of American view. So I will remind myself and remind other people, you know, we're having discussion about whether or not you should be vaccinated, mm-hmm. because you have access to a vaccine,
right?
Where most of the world does not have that access,
right?
So I think because of that, this story is still going to be told.
Okay.
That's why I sort of gave this little soliloquy about the importance of a mask and how that may end up taking a permanent place in our lives somehow, because we can tackle this and be in a good place with this virus in North America. They can in parts of Europe, but you know, air flight makes this a much smaller world. So I think that it remains to be seen. Now, I will tell you that in my medical practice, I am not a fast adopter of anyone, mm-hmm. or anything. Mm-hmm. And I will still be very cautious in terms of using a mask. I think the story will be told with what the next variant is, mm-hmm. and what direction things are going in. So with Omicron, what we saw was that it was much easier to catch. It was much more transmittable, but in particular in patients who were vaccinated, if you came down with this variant, you had little or no symptoms.
Right.
So because there are enough people in the world who are not vaccinated, there will be another variant eventually. It's just what form will that variant take?
Okay.
But I would say right now we're in as good a place as we've been as in for a long time.
Okay. So that brings it up. In full transparency, I am double vaxxed, boosted, and I have my flu shot, and I still caught Omicron. But the Omicron didn't, it didn't get me that bad. It was like a bad cold, essentially, and I was able to get over it within a week or so. So I didn't lose taste or smell. I didn't lose my appetite. I had a little bit of tiredness, a little bit of fatigue, some chills, some sneezing, a little bit of coughing, but nothing really major. So I thought that was interesting. And some of the questions that we're getting are around the variants. And so before we get to that, I wanted to ask, I saw at the end of your presentation about, if I get the vaccine, will I get COVID, or are you injecting COVID into me when I get the vaccine? So can you make the distinction between what a vaccine is and what an inoculation is?
Okay. All right. So a vaccine is a delivery of a substance, usually a protein, that affords you protection against a virus. And it can be, depending on what the virus is, it's sometimes being infected with the virus at all. And at minimum, with it, just about everything else, controlling the effect the virus has on your body. It was interesting. I think your wording, I don't want to take it too much to the sports world, but it reminds me of how a famous person sort of disguised whether or not they were vaccinated. Inoculation implies more of an exposure to the virus. Okay. So I'm glad you said what you said, because you brought up some very important talking points. So number one, when I hear your story, it makes me say the vaccine did its job.
Yes, absolutely.
Okay. So the vaccine kept it so that you got a mild illness and you were able to keep it moving.
Yes.
Okay. The issue with inoculation and just relying on exposure is that we just don't know how protective that is. And that could vary from person to person, because people have different medical illnesses and not everyone's immune system is the same. Not everyone's immune system is the same strength or as protective. So because COVID can be so devastating, you're taking a chance by just relying on having had COVID and relying on whatever antibody response your body was able to generate, because there's no great way to measure that. And despite what you may hear or what you read, the defense that a vaccine gives you is superior. Yes. It just is. Yeah. It's been proven. So unfortunately, just having had COVID or been exposed to COVID, it's just given too many people a false sense of security.
Right.
And, another thing, and we used to have this in earlier talks, and I used to talk about this a little bit more, is, the decision to get vaccinated is not an individual decision, because nobody lives in a vacuum. Okay. So we're talking a lot about what it means if I get COVID, but you have to think about what it means to the other people in your life.
Yeah.
Okay. Yeah. So that depends on who it is, what their status is, if they're vaccinated. So it could be the risk of you exposing them to COVID. And it could be something that we take for granted. It's just the role that we have in other people's lives.
Right.
So I know for me, I knew that, well, you know what? If I get really sick and I can't work, that doesn't affect me. That affects my family. It affects my coworkers.
Right.
Because even though we don't think about it, most of us have a responsibility to at least one other person besides ourselves.
Right.
So that's something that I think people don't think about, but it should be give it at least some consideration when you think about getting vaccinated and trying to maximally protect yourself.
Right. So thank you for that answer. And it touches on the variants. And that's a question that we're getting from the audience. How many variants have there been? And are they waning in their infectiousness as they mutate? And are the vaccines being updated to accommodate these variants? Like, are we going to have to continue to get more and more vaccines as more variants come out? Or, they talk about these boosters. So how many variants are they as they come out? I guess you mentioned that earlier. We'll have to see what happens with the next variant. Is it going to be more deadly as it mutates, or is it going to wane and be more like Omicron?
So the variants so far, and especially with the latest, have proven to be less dangerous in that they are easily communicable, but they don't have the same damage.
Okay.
As the previous variants.
Okay.
Whether or not there are more variants and how aggressive they are really dependent on us and the percentage of the population that's vaccinated. As I said earlier in the talk, every time the virus is able to infect someone who's not vaccinated, they get a chance to become more dangerous. Mm-hmm. They get a chance to become harder to detect. They get a chance to figure out how to affect different organ systems. So it's almost like, if you're not vaccinated, you're giving a thief a roadmap to your house. So it really depends on how many of us go ahead and get vaccinated. Again, there are some dangerous assumptions that I think are potentially being made in terms of how much protection just having been exposed to COVID gives us. Mm-hmm. So it's really going to tell. That's why we still give these talks, because we still need more people to be vaccinated. There was this thought about earlier in the pandemic about sort of the community and enough people getting COVID and that protecting us. But, again, we see that that's not as effective as we would like it to be. And still, nothing beats a vaccine in terms of being protective.
Okay. So another question, what systems are in place? Excuse me. Sorry, I'm sorry. What's happening? What's good grief? 1 second.
Deb, drink some more water.
Right. I don't know what happened there. Do the benefits of getting the vaccine outweigh the risk of not getting it at all?
Yes. So if you happen to read the New York Times, and every day in the New York Times there's a little update in terms of the direction of the number of cases, how many new cases there are, and how many deaths. There still are, by my last survey, over 2,000 people a day in this country dying from COVID. Every day. And we've become a little bit numb to it, but that's still a lot of people dying. I mean, it's almost reminiscent of, when this country's at war and they would talk about how many casualties there are. But we've just become accustomed to it. Now, the people who are dying in the hospital with COVID, almost invariably, those are non-vaccinated people. That's just been proven over and over and over again. So that just tells me that there still continues to be an advantage in how you do, depending on if you're vaccinated or not vaccinated. So it still is clearly a worthwhile and smart thing to do.
Okay, so we often hear about the long haul patients. I know, even though it didn't affect me greatly, I did still have some long haul kind of effects in terms of tiredness and a little bit of like what they call the COVID sort of fog, like the fog. So like, sometimes when I'd be in meetings, I forget where I was, not necessarily like physically where I was, but like where my place was, or sometimes having a hard time formulating the right words to get out what I was actually thinking. So, are there systems in place to find side effects, help for the side effects after approval?
So yes, so pretty much every discipline of medicine is seeing some manifestation of this. So all of us are working on what the long-term effects of our respective organ systems are. So there's a lot of research going into it, just because every day there are more and more patients who have been infected and more long haulers. So when you think of all the people who have had COVID, and 33% of them at least are long haulers, that's a lot of folks who have long-standing effects. So there's being a lot of research time and money spent on research of what those manifestations are and what we can do to curb them. But that's still a work in process.
Right.
And as I said, I'm sure, 5-10 years moving forward, one of the most important things we're going to ask every patient when we do a history is, did you have COVID?
Yeah. And we know, early on before the vaccine came out, some of the sort of side effects that were happening from COVID infections were that it was like affecting the nervous system. So it was like, because it was such a novel virus, it was like, what is this? Like, it should start as or end as just a respiratory ailment, but it had started to affect people's neurological system. So do you have any, take on that or any
I mean, we're still learning, and specialty to specialty. So, for instance, in urology, we're seeing that having an infection with COVID is affecting fertility and men's sperm counts. So, and all of these things are revealing themselves in every specialty. So, you will hear more and more about this in the months and years to come, because we're just beginning to understand what all the manifestations are, and then even within that, we'll sort of, what is there a difference between the different variants and how they've manifested themselves.
Mhm.
So this is really a burgeoning area of research.
So, much like, the flu comes around every year and there's basically a new variant of the flu, and people get vaccinated for the flu every year. Do we think there'll be iterations of the vaccine and booster shots as we go forward? And will this be something that you think that we'll live with for a while, like the flu? Or
It's very possible. I think we're being very cautious now in terms of next steps, in terms of recommendations. I think just from a public health point of view, all the emphasis is on getting as many people as possible vaccinated, because that just changes the outcome completely. So if we can get enough people vaccinated, that's all the less chance there'll be a significant variant, which is all the less chance that people will need to get vaccinated. But it's really up to our behavior that will determine whether or not how dangerous the variants will be, and subsequently how important it will be that we'll need boosters. But I think right now, the emphasis is on getting everyone vaccinated.
All right, great. All right, so we're going to move into that sort of the politicization of the vaccine in a second. But you mentioned in your presentation about, that the FDA has just approved the vaccine for children as young as 5. And so just one more time, for the parents that are listening out there, are there any concerns that they should have about the vaccine as it relates to their child and their child's development or anything like that?
So, no, but I will tell what I've said from the beginning. This is a very individual decision for everyone.
Mm-hmm.
And there has been a lot of positive data about safety.
Mm-hmm.
Everyone is an individual. So don't pause yourself, or don't paralyze yourself in terms of your decision making. So if you hear something and you have a concern about your child, or your child has a particular illness, or there's a particular question, go to your child's pediatrician and say, listen, I understand that this is proven to be safe, very safe, but my child has asthma. My child had this reaction. Get that confirmation from your pediatrician or your primary care provider so that you feel comfortable with the decision. But widely, it's been proven that not only are the vaccines safe in children 5 to 11, but that they tolerate the injections very well.
All right, that's great. So now we will move into how we as citizens have handled this, basic pandemic, this global situation. So why does this particular vaccine seem to be so politicized? Why are we as a society so against community health and mask wearing?
So, I have to be fair about this, especially in people who are hesitant about getting vaccinated. So people in this country of African descent have a history with the medical community.
Yes.
That has rightfully fostered doubt. But I think that you cannot let that stop you making the best decision for you and your family in terms of your health and safety.
Right.
So I think that that's an important thing to get out there. I think that that's probably why in my practice, I'm not a fast adopter of different things. And even with this vaccine, I did my due diligence to make sure that this was a safe thing for me to do. And I got my vaccine, and I, like you, am vaccinated and boosted. It's a complex question. I think people conflate the importance of public health and the importance of personal rights. If you went to school in New York City, you couldn't go to school unless you had that little yellow card, a little blue card.
Absolutely.
And your parents went and got you vaccinated. So most people who are on this call,
right,
you got a whole bunch of vaccines.
Right.
And those vaccines stopped you from getting many different diseases. Right. So, 70 years ago, polio was a real thing.
Yes.
Many diseases are a real thing, and they are not today because of vaccines.
Right.
I think the other challenge is that there's so much unfiltered access to information.
Yes.
And it's hard to know what to trust.
Yes.
Just because of technology.
We're in a 24/7 news cycle, and there's a lot of time to fill up. There's a lot of, I'm a man of a certain age. We're, same. There used to be a time when the news came on at 6 and 11 or 6 and 10. And there were 4 channels that were dedicated to the news. And you got straight news, and you didn't get a whole bunch of conjecture and politics injected and opinion and all of that. So now with the 24/7 news cycle, and then with the advent of social media and podcasting, you have a lot of people who are able to hit the airwaves and get followers and listeners who listen to their particular way of talking about virus, and you drink this and you'll be fine and you'll be protected. And I do believe in having a healthy immune system and working out and eating clean and that whole thing, but you still need some other things that will help you beat off virus. So
right.
Yeah.
Right. And, one thing when you've seen through this is, not everybody who's giving you information necessarily has your best interest in mind.
Right.
Okay.
Yeah.
A lot of, I don't know the right way to phrase this. And this, I'm sure, is from my dad, but it goes something like, watch what someone does, not what they say. So there is a extremely well-known news outlet that has told a particular narrative about this.
Yes.
And at the same time, that network, you can't be in that building unless you're vaccinated.
Absolutely. I know exactly.
And I know a lot to the African-American community. There have been a lot of information directed specifically to that community that is not supportive of vaccines. But I think we would all be surprised to find out how many of those people who's sharing that information are vaccinated themselves.
Right, right. So
Um,
to that point, and I don't want to get too political, because we're not here for that, but do you feel like this current administration is doing a better job at being able to handle the vaccine? I know that, I think a lot of the distrust that we're sometimes seeing from our everyday citizens, our American citizens, is really because, admittedly, from the former administration and even this current one, there's always this kind of like someone coming on giving new updates. The CDC says this, the World Health Organization says something else. And so I think that may have caused a little bit of the distrust or the advent of misinformation. But do you feel like this current administration is handling the pandemic a little better?
Oh, I think they've handled it a lot better, just from to the admitting that it's a problem.
Yeah.
And wanting to put resources and make resources available for people to protect themselves, and resources available for people to get reliable information.
Mhm.
I think the challenge of this administration has been there's still been a lot of noise
Mhm.
to maybe suggest that they're not doing everything that they can,
Mhm.
but I think that they're doing as much as they can. I think the other challenge they have is that the country has COVID fatigue.
Yes.
People want to get back to normal,
Mhm.
but I think we have to face that. There's going to be a new normal.
Yeah. Yeah.
My concern about all the rollbacks going on now is, what if the next variant is more aggressive and we really do need to start wearing masks again?
Mhm.
Are people going to listen?
Listen, yeah.
You
Uh,
know,
it's interesting because, like I said, we're doing this event every Thursday, and the whole series is on COVID. The last week of the month, on the 24th, we're having a panel of mental health experts that are going to talk about the mental effects of COVID and, isolation from being, inside and having to quarantine and that sort of thing. So, when we talk about health, talk about the actual vaccine itself, but we also talk about like, the psychology of it all and how it can affect people in dealing with their mental health around this as well. So I think that it's just very, very interesting and fascinating how this particular virus has really shifted how we interact as a society.
no, very, very, very true. I mean, it, it's interesting in terms of mental health. It's sort of COVID has had its own manifestation that's not direct, but is in many ways as consequential in terms of mental health, especially among children,
Yes.
and how disruptive this has been for them.
Yeah.
But at the same time, these were measures that had to be taken
Yeah.
for the public safety.
Yeah. Absolutely. So we'll move away from the politics of it and go right back to, there was another question from the audience, and it says, what may be the outcome of a person taking one dose of the vaccine and refusing to take the second dose or the booster?
Sure. So in general, and I'm talking mostly about the Moderna and the Pfizer,
Mhm.
taking one vaccine gets you 50 to 65% of the way there
Mhm.
with your immunity.
Mhm.
And we know that immunity can wane over time. That's why we encourage boosters.
Okay.
So it's better than no vaccine, but it's like wearing armor into a fight and just wearing half your armor.
Okay. And so to that point, like I said, I mentioned to you that I'm double vaxxed and boosted, but still was able to catch Omicron. With the amount of people that were catching Omicron, even though they've been double vaxxed, or the folks that were not vaccinated caught Omicron, does that help us get closer towards herd immunity, or is it just that particular variant that they were able to beat?
Um, the bigger variable in that is probably the people who were not vaccinated and had no protection.
Okay.
That is really what's going to count more towards herd immunity.
Okay.
I mean, you have your immunity, you have your protection through the vaccination.
Yeah.
We're still worried about all those people, other people who aren't vaccinated, who are, and we call it a vector, who are a vector for the infection. And, not only is it the risk of you getting a serious infection, but also the risk of you spreading it to other people.
Right, right. And so again, you hear people talk about, oh, well, I had COVID, so now I'm immune. So I don't have to worry about it. I can just be out there. Of course, you can catch it over and over again.
Right.
But if you've been double vax boosted and you caught the virus still, like I did with Omicron, are you kind of superhuman in the sense of that, you got the vaccine?
I would say you're as safe as you possibly can be.
Say, okay, good to know. All right, and so then we're coming up on the end of the hour, and I just wanted to say, what about your thoughts on the mandates? Are they good? Do you think that they're something that we should follow? Or should they be lifted? How should we handle that?
I mean, I think it's incredibly important that they're as apolitical as possible.
Yes.
And this phrase "follow the science" has become a huge cliche.
Yeah.
But it's true. And time and time and again in different areas, we've seen countries get into trouble when they've rolled things back too quickly.
Right.
And people roll things back too quickly very often for political reasons.
Right.
So I think when when you're personally evaluating a mandate being rolled back, and this is Dr. Alfred Winkler speaking, not New York Presbyterian. Sure. I think it just behooves you to think about sort of what the motivations are for those mandates being rolled back. Yeah. And they're good guidance, but they're still guidance. So in the hospital setting, we've seen infection rates drop precipitously. I mean, very quickly, to the point where how safe I feel now is completely different with what's going on 6 weeks from now, of what was going on 6 weeks ago.
Yeah.
So it's made a big difference. And I think that we just should do things stepwise. So I like the fact that, they're doing it in some segments and not others. So I still think people should be wearing them in public transportation and crowds. Right. I think kids in school, because we're not completely out of the woods.
Yeah.
But I think we need to take small steps and make sure each small step isn't turning out to be a step backwards.
Yes. Okay. Well, as we wrap, do you want to leave us with the top 5 things you think that we can do as citizens to help continue to beat this virus?
Stay curious.
Mm-hmm.
Be careful about your sources of information.
Mm-hmm.
Take care of yourself.
Mm-hmm.
Take care of the people around you.
Mm-hmm.
And get vaccinated.
All right. I mean, that really is the key. And getting people over the fear of the vaccine. And I'm very grateful for you joining us this evening to share the information that we shared. We had a nice conversation with the Q&A portion. I think that we hopefully were able to get through quite a few of our viewers tonight that were enlightened by this conversation. So thank you again for joining us. And thank you all for tuning in tonight. Be sure to join us every Thursday this month from 7 to 8:30 p.m. here on Facebook Live as we bring you this slate of informative programming. Next week, we're going to have a voters town hall with Brooklyn Councilman Jay Osei. And on the 24th, as I mentioned earlier, we're going to have a mental health panel of experts to talk about COVID as well and how to deal with the mental stressors that have come from dealing with this virus. So again, thank you, Dr. Winkler, for joining us, and have a good rest of the evening. Take care.